Good afternoon and welcome to the second day of the General Assembly. I hope the participants and the involvement of all of you will be in the same line as yesterday, with full discussions and sharing ideas about the topics that we are planning to manage today. It will be mainly three topics to be covered today. First one is the sustainability of thinking in the future. It is quite important. It was also a message and advice coming from the reviewer panel last November. We must be focusing sustainability. And the second part will be focusing the future of harmony. And one part of the future of this harmony is, of course, sustainability, but the other one is Harmony Plus and the new projects coming. And these are the three main steps in which we are now, we will discuss. The first point is sustainability. It is really an important topic. Harmony approaches several companies in order to give or to ask for advice coming from these different companies. They are related to business. Most of us, we are not economists, we are just clinicians and scientists, but no anymore business people. And after some discussions, we decided to go to Estradu for doing and for manage this sustainability in future. And it is the reason why today we have invited the CEO from Estradu, Dr. Michael Müller, who will provide some guidelines, some general guidelines about how is the situation that we are now in which is the present point in which in the discussions regarding the possible model, future model for harmony. We perfectly understand and we know that harmony is not really an easy project to be managed. But on the other hand, I think it's really important to have Michael with us and providing us advice about this sustainability. So let's move to the presentation coming from Estradu. Welcome, and after the presentation we will have questions. We will follow the same scheme as yesterday, raise the hand, and if possible to be able to manage all the full debate after the presentation of Dr. Müller.
Good afternoon, ladies and gentlemen. It is our pleasure to be here as a team member of Harmony for the first time in a General Assembly, kind of new kids on the block as we joined the initiative relatively late. And as you can see here, the purpose of the meeting today will be to give all consortium partners an overview and an information about what is the current status quo of the sustainability project, what methodology has been used and what interim results have been achieved, and also inform about next steps and timelines related with the project. Only to remind you, the scope of the project, the objective of the sustainability project, I'm sure in principle you are all aware, but the objective was and is to develop a business strategy and a business case for Harmony to be sustainable after the grant period. That means to generate a strategy and a case describing what kind of funding sources Harmony can have, may have, should have after the grant period is over and there is no more granting of funds from the initial initiators of the project. And in order to run the project, it had been structured in 4 phases. We started with an assessment and a mapping of expectations. Assessment means we we made transparent, available data, scope of data, comprehensiveness of data. And of course, that changed over time, because when we started the project, there were almost only half of the amount of data on the platform that are on the platform today. So it's a moving target, obviously. We also mapped expectations from internal stakeholders as well as from external stakeholders, what they would expect from such a platform in order to deliver and in order to what benefit it could create. Then in phase 2, we tried to make transparent what are the cash burning elements, what is the money spent for in the current situation, but also to translate that into considerations. How would money have to be spent after the grant period? Asking what kind of services may sustain and will be provided in the future. We have been assessing the resources on the platform of who is doing what, how many resources are required, what is done internally, what is done externally with vendors and partners. And then over the time, we started building first hypotheses. That was towards the end of phase 2, and then at the beginning of phase 3, building hypotheses, how business models for a sustainability of Harmony after the grant period could look like. That means, and I will come to that in much more detail later on, asking what kind of services, what kind of products, what kind of sources for revenues or fundings could exist after the grant period that would allow Harmony to live on even after the grant. And that phase 3 is actually where we are currently in, and you will see that in more detail in a minute. And in phase 4, which is the last project phase, which is about to come during the next 6 to 8 weeks, we will be defining a business strategy and a business case that will give revenue assumptions on revenues to be generated after the grant, and also on costs that will occur in order to fund the resources needed to generate the revenues. This slide illustrates the project time so far, and what you can easily see, at least the ones of you who have been familiar with the project before today. We started in March, and initially our all plan was to finish the project before the summer break, so by July. And then what nobody of us knew, the COVID pandemic stepped in, and we had to pause the project work. We had to first pause methodology, then change methodology, and work remotely. In the very beginning, meaning in April and May, we first thought that might be over soon, so that we could come back to the initial methodology after a while. But then we realized after 2 months of COVID pandemic that would not be the case. And that was the main reason why we, after intense discussion with the executive committee and the steering committee, decided to change the methodology and go away from smaller physical workshops and more interviews to a survey that we had run then in the months of May and June, an online survey that was addressing all consortium partners and gave the opportunity to everybody to feedback on a huge amount of various different topics. And I will come to that also a bit more in detail later. Next slide, please. But only to give you a brief overview. So in those first 2 phases of the project, we have been involved in many individual interviews with the management and the hosting partners of the platform, with Jesus and Santiago, but also with the secretary on budget and spendings. We have done single interviews, partly at the beginning physical interviews face-to-face, later on then telephone interviews with various of the key partners from the clinical side, but also with one of the key partners from GMV supporting the Harmony work. But also we did a lot of external stakeholders and experts interviews, people who are involved in similar activities or who could serve as experts based on the experience that they have, people from commercial corporations dealing with real-world evidence and publishing scientific information like IQVIA or Elsevier, one of the major publishing houses in the world, representatives from Helmholtz Institute and other institutions, but also a lot of other representatives from other pharmaceutical companies involved either in Harmony or in other platform projects. So some of the members that you see here that have been interviewed are also involved in other IMI projects and have experience from other projects with a similar nature, but in different indications. And what we have also done is anticipating a little bit what are the services, what are the future business models that a platform like Harmony would be engaging in. And based on those thinkings, we have started to create benchmark information on other activities that are comparable to some extent, that are different in other extents. For instance, you see on the very left and in the middle on the top, you see two other IMI projects, one on prostate cancer, the other one a call that is currently running, a major call on 5 solid tumors with various partners involved. On the very left in Pioneer and Pioneer Plus, there is also sustainability consideration ongoing, and in some of the topics they are much more advanced than Harmony is today. In Optima, which is a call that is currently running, that will be started, the project will only be started in 2021. But the difference is that in the new IMI calls, the sustainability as a work package is embedded from the beginning. You remember, all of you have started with Harmony without that sustainability already be embedded in the processes and in the consideration, and it had been, as a project, had been docked on relatively late, the beginning of this year, while in the new projects, as it is so important, it is embedded from the beginning. And there is also from the beginning already in the period of the call to be submitted, there is already discussion with external partners on potential commercialization models for the platform. We have benchmarked the initiatives with other oncology platforms, such as Clinical Path or Flatiron in the US, which are to some extent highly different and cannot be compared, but in other regards are highly comparable to what Harmony does. So there's definitely a lot that you can see and learn from those. We have been speaking and benchmarking initiatives with players like Smart Patient, that is one of the leading developer for digital therapeutics, who are generating currently a lot of real-world evidence that they market. So it's a different and a very innovative model of marketing real-world evidence that is generated from treating patients. And of course, we have included in our benchmark analysis the Multiple Myeloma Research Foundation and Medidata, which is an interesting provider of medical information and data, generating today almost 700 million of revenues from providing evidence and medical data. We have included the Cancer Genome Atlas in looking what they exactly do and provide and how they are funded. And we have included companies, and that is not an exhaustive list. The chart only serves to illustrate you the various let's say, different clusters and archetypes of initiatives that we have benchmarked throughout the project. In the lower right corner, you see a kind of new company, which is Tempus. Currently one of the fastest growing and most innovative platforms for genomic sequencing data in oncology. A company only recently founded with a $5 billion backing for several activities that, and we will see that later on, what they provide is clinical decision support, is real world evidence marketing, is profiling patients for clinical trials, is companion diagnostics matching for stratified medicine on genomic sequenced patients, etc. So a whole lot of activities that they cluster in one platform, and some of that is very relevant and very comparable to what Harmony may do in the future. And it is a fascinating example of how much funding such a topic, such a theme that we are all working on how much funding such a theme can generate. Now, I mentioned that as we had to change the methodology and go away from the physical meetings in April and May that were intended and foreseen in the methodology, that we started that large online survey. And that was a survey addressing different topics of Harmony and the platform work. The first chapter was about the status quo and the general achievements so far. Second was on infrastructure, then about the collaboration with clinical centers and the collaboration with the pharmaceuticals industry. The performance of the different work packages, initial ideas that consortium partners and members would have on what should happen with Harmony after the grant periods. And if something should happen, what would it be? What kind of business models could they think of that Harmony could be involved in? And finally, initial ideas and hypotheses on future corporate structure, governance, and there was a specific section also for the clinical centers only, which dealt with cost of data, circumstances to provide data, nature and freshness of data, etc. That had questions only for the clinicians. And in the following few slides, I want to give you a little bit of an overview of the results. That is, of course, not the detailed report of the survey, but it highlights the most prominent and most important results of the survey, consolidating the opinion of the attendees of the survey. So first, good news you could say is that almost everybody is convinced and was convinced that Harmony should continue to exist after the grant period. 96% of the participants of the survey said that Harmony should go on after the grant. They believed that there is a strong potential for commercialization of services, and that commercialization of services would be the source for funding future activities. And saying commercialization of services does not necessarily mean in a for-profit organization. It could mean, and that was not the nature of the question, it could also mean commercialization of services within a non-for-profit organization that uses services and revenue generation in order to self-fund their activities going forward and not to generate profit for the shareholders of whatever company. However, there were also very clear and manifold signs of significant existing hurdles and shortcomings that would have to be overcome for Harmony if it wanted to exist after the grant period. There was, in general, a high appreciation for the management of Harmony today and the personal commitment of the management within Harmony as for today. While some members also questioned what, with regard to the location, what might be going forward a best location for hosting such a platform. And what also had become obvious in the survey was that most of the participants from various angles and perspectives commented that the achievements so far, that they would lack expectations regarding accrued data, regarding research questions already tackled, regarding regarding results already generated. With regard to the processes, the attendees commented that the process for data acquisition would have to be improved with regard to timing, but also with regard to how and who would contribute to data acquisition. They commented that there was a limited involvement, that there has to be a limited involvement of certain stakeholders when it comes to decision making in order to be more efficient and faster in the future. That of course referred to some specific work packages, not in general. And it also had to be seen in the light with limited veto rights that needed to be there, or that were perceived to be needed in the future when it comes to deciding on research proposals and being unbiased and efficient in decision making. Attendees commented that the process of identifying new centers and recruiting specific patients with specific mutations, etc., would have to be improved and speeded up. And they also commented that the collection of clinical data was not satisfactory so far as for today. Various aspects here. Comments on not enough data, many comments on not fresh enough data, not young enough data, and some subgroup of participants also mentioned that they believed that the compensation for the data was not enough. With regard to the infrastructure, there were comments on a too long process for data harmonization and the TTP process. They also requested better tools for transparency and availability of data on the platform already. Many comments on a professionalization on the website for two different purposes. One, attract more members, and B, to provide better platform communication, or to use the website in order to leverage and enable better communication within Harmony. Some comments on questioning going forward and in a period after grant, questioning external providers for services with very different aspects here, and of course not uniformly on one topic. Many comments dealing with the organization of Harmony per se. A lot of them asking for improved outcomes and efficiency in the work packages, stating that there was a need of a better leadership in some of the work packages, that there were hinders due to the nature of the project, which is the European IMI project that requires a lot of what participants perceived to describe as bureaucracy that would probably have to be overcome after the grant to be better, quicker, more professional, more effective, etc. A better data analytics and therapeutic evaluation that was said to be not satisfactory today, and a very strong commenting on work package 2, with 60% of the answers commenting that work package 2 should be more unbiased with regard to formulating research questions or accepting research proposals, etc. And that also handed over to the request for a better and more effective internal alignment of the partners from the pharmaceuticals industry. Overall, the attendees of the survey requested a more collaborative structure, including not with regard only to this, but including an improved collaboration with the pharmaceuticals industry. And they also mentioned that the current structure of the organization as a project with an executive committee and a steering committee would definitely need to be modified after the grant period in order to run Harmony more like a general management instead of that multi-level and multi-angle complex organization that it has today. When we asked for what were ideas, what were hypotheses on what Harmony should be doing after the grant period and which business models could be used in order to generate revenues and funding, 84% of the respondents mentioned and were convinced that Harmony should go for commercial business models in order to fund activities. And that was a long list of activities, but the most prominent ones, the ones that were mentioned in almost all of the answers of the survey, were building AI tools focusing on hematology, undertaking dedicated research questions for either institutions or pharmaceutical companies, designing in silico virtual clinical control arms out of the data, possibly create a clinical decision support tool. I've been writing here a la Flatiron, not comparing Harmony with Flatiron, but using Flatiron to explain what a clinical decision tool could be good for and how it could look like. Providing a clinical trial finder for patients with specific mutations for each and every center across Europe treating patients, and the commercialization of the real-world evidence that is, without any doubt, created on the platform in a very huge extent, and that real-world evidence could be commercialized either with regard to research questions for the pharmaceuticals industry for marketing purposes, but also for governmental purposes and health technology assessments. So very different aspects here, but all relying on the real-world evidence generated on the platform. So let's say summarizing on the survey, and as I said, it's just a brief overview of the manifold results that the survey has given and the various subgroup analysis that we had done on the survey, asking what answers come from what subgroup of attendees, etc., and to see the differences here. But as a summary, the phase 1 and phase 2 of the project have given very clear guidance on achievements and existing shortcomings. And they have also indicated that there is a clear need for change in order to continue after the grant period. But they have also given a clear proof that there is a strong expectation that Harmony would continue to exist after the grant period, and not only a conviction, but also a willingness of almost all consortium partners. And interviews and survey have started to give a bunch of initial ideas and components and hypotheses of how future revenue generating business models for Harmony could look like, and how operations could look like, what structure could be used further on, and what governance might be required. But of course, and that indicates that we are only not even at the end of phase 3 of the project overview that I have shown at the beginning of the presentation here. Of course, there are quite some questions remaining now in order to to complete the project. And those questions now are, number one, what exactly is it that we will do? We have a lot of ideas, we have very concrete ideas and some vague ideas, but what exactly is it that we would like to do? Where is the focus of Harmony? What business models will we engage in? What revenues will that generate? And who will be the clients for those services? And then after that has been answered, the next subset of questions is, how do we do it? With what resources, which infrastructure and technology, what cost will occur in order to do it? Because future setting is different from existing settings. So it would be not correct only to extend the current existing annual budget for Harmony in order to come to a future budget. But budget depends a lot on question number one, what is it exactly that we will do in the future? And then third group of questions, in what kind of organization will we do it? Will that continue to be a partnership, a consortium? Will it be a foundation? Will it be a commercial company, etc.? And other questions around that topic. So in order now to collect all the pieces that we have and to bundle and focus it into those group of questions now, we have decided that towards the end of the month, we will start with two important workshops. The first workshop will be on October 28th, and I believe many of you have already seen the invitation for that sent out by Santiago. Those workshops will be, we hope that they will be, and we plan for that, in part physical workshops. So there is currently still the planning that at least a subgroup of workshop participants would meet in the Madrid area and come together for those workshops, while several other participants would join remotely. And the first day will serve to answer the first subgroup of questions. What is exactly that we will be doing? What business models will we engage in? How will we generate revenues? How much revenues will that be? And as the question has popped up in one of the previous internal discussions that we had, I've just wanted to show you a few examples of how the detailed questions that we are going to discuss on the 28th will look like. For instance, one business model that has been mentioned very often, and that might be a very obvious business model for Harmony in the future, would be to provide clinical trial, in silico clinical trial arms, instead of actively including new patients, enrolling new patients, using existing data to build an in silico arm for a clinical trial. So if that is a business model that you want to embark in, then the question would be, what kind of clinical trials will we be seeing in the next years to be addressed to the platform? Does Harmony have enough data to answer those questions? So to build a clinical trial arm with the data. Is that enough data? Is it good enough data? Is the structure of the data suited in order to build such a clinical trial arm? Do we have enough centers that will be needed? You all know that for clinical trials, it is not only relevant to involve a certain number of patients that are suited for the clinical trial, but also to enroll a certain number of clinical centers for various reasons. You want to enroll several different regional centers, clinical centers in different regions, in different countries, etc. And a sub-question will be, what will be the cost to acquire the data for that continuously? Because it is obvious that if you want to to build clinical trial arms, the data has to be always fresh. You cannot build a clinical trial arm in oncology with 10-year-old data. That does not make sense at all. So what will be the cost always to have up-to-date and fresh data on the platform? And then a significant question is, what would the pharmaceuticals industry be willing to pay for such clinical trial arm composition on the platform? So what revenues would that business model then generate? And a question that is also evident and not trivial is, who will commercialize those services? Because let's suppose it will happen. Let's suppose there is enough data. Let's suppose the pharmaceuticals industry would want to buy the data for such a clinical trial arm. Harmony would only be in one subset of indications in the medical world. So the same questions arises in other oncology, arises in cardiology, arises in all kinds of disciplines. So of course, the commercialization of such services might be depending on scale effects and might be better in other hands, in the hands of a company that is providing such services across the indications. So one could imagine that we generate the data, but we not on Harmony do the commercialization on our own, but would run into an alliance with a company that typically runs clinical trials. So companies like Quintiles or others, several around. And next question, would we do dedicated research questions answering? What type of research questions would that be? What level of specificity can we deal with? Are we handing out the data, or are we only handing out the information? And are we collecting the information from the data on our own, which would then in return require that we have an organization of data scientists that is getting the information out of the data? And that has to do not only with the question, what do we want to do, but also with the question of data protection and data laws in Europe, which are different than in the US, and so on. So I don't want to get even further. You will all get those slides and the presentation of today that illustrates for you later on as a read what could be questions in selling real-world evidence, what could be questions in providing a clinical decision support tool. Is that relevant for Europe? Does Europe need a clinical decision support tool in hematology? I am pretty convinced that many of you attending today would not need a clinical decision support tool. On the other hand, many of the clinicians not attending today in Europe would probably benefit a lot from a clinical decision support tool that would give clear guidance on what to do with the patient, and maybe also give information in which clinical trial to enroll the patient, etc. So those are the questions that have to be answered on the first workshop on the 28th. And then, as that is the second most important, on day 2, on the 29th, once we have maybe not finally completed, but a lot narrowed down from day 1, the information, what is it that we want to do? We can then conclude on the question, in which setting? What will be the corporate structure for that? Will it continue to be the partnership as it is today, or will it look different? And as that is a highly complex question, that second workshop is currently internally prepared by rounds of internal discussions orchestrated by Santiago and Jesus with the executive committee, with the steering committee, etc., in order to have already guiding ideas and thoughts for that workshop on the 29th. And then after those 2-day workshops, at a non-defined point in time and with a yet non-defined group of participants, we will then be in a position to answer the remaining question, which is much easier than the first 2 subsets of questions, the questions on what resources, what cost, what FTE behind, what technology, which services, or what kind of work done internally and what with external vendors. And that is something that we can answer then after the first 2 workshops have been completed. You can all imagine, looking at those questions that you have just seen, how difficult that is in a world of pandemic today. Those questions, they would be difficult to be answered in a group of workshop participants sitting for a full day around one table. And it is, of course, a lot more difficult to discuss those questions with participants only participating remotely. So what we will do, we will try to prepare those workshops at the best, using innovative workshop methodology like WooClap, for instance, which will allow in the workshop to use flip chart and brown paper discussions and methodologies as if we were physically in one room. We have, well, fortunately, unfortunately, during the last 5 months, we had to be in a position to collect a lot of experience, because all our work with our other clients in our consulting projects, unfortunately, in the last 5 months, did not happen in physical meetings, but took place in remote meetings. So we have been engaging a lot in such workshop methodologies. That comes back to the remaining time acts, showing that phase 3 will now conclude in the 2 already defined workshops on 28 and 29, and then in a remaining subset of little workshops for the remaining questions in the days after. And then we expect to be in a position to finalize phase 4 of the project within another 4 weeks or so, in order to hand over sustainability strategy and implementation recommendations. Yeah, and that only illustrates an already discussion that we had in the core group of the project, thinking of who could probably contribute a lot to the different question settings, to the different workshops and subsets of questions. But of course, this is not a final list. What is clear, though, is that the workshops will only be possible with a limited number of participants. You cannot run those workshops with 50 participants, so we will probably have to limit the workshops on day 1 and 2 to approximately 10, 12, 15 participants, depending a bit of the nature of the participants, so that it still remains handleable with the remote technology. But I know that Santiago has already sent out the invites. There will be more concrete invites for the ones who commit to participate to the workshop, with pre-reads to the workshops and explanations for methodology, etc. And we may also, only as a head up, we may also reconsider the timing that Santiago has put in the email, because both workshops so far in the timing already addressed were planned to start in the morning, Central European time. However, if it turns out that there is a need and a benefit to include a significant number of overseas participants into the workshops, then we would probably reschedule and start the workshops later during the day in Europe, so that US or other abroad participants have a chance, or have a better chance to join without getting up 1 o'clock in the night. Thank you very much for your attention and for listening. And now it's open for questions.
So thank you, Dr. Miller. Really this comprehensive story about sustainability and the results from the survey. We have 4 questions in the chat. Renate Schulz-Rath made a question: are the results that you are currently showing from the majority of the participants, or only the opinion of one or two people?
No, what we have shown in the overview is clearly not the answers of one or two people, but we tried to summarize in the set of charts what is the majority opinion coming from the platform. Of course, you can imagine if you have seen the survey, there were a lot of open questions in the survey. So everybody is phrasing it slightly different, but all the topics that we have mentioned are not single opinions. We have completely excluded single opinions here and only summarized what is majority opinion or has been a clear sign throughout all the answers that we have received.
Sophie Wintridge asked a question regarding the work package 2. It was you made a comment that someone told that some people think that they are biased project, and she told more unbiased in that way. In what way? What kind of bias was observed?
Well, the question that is addressed here is whether a work package that is deciding on research questions should be completely free of particular interests with regard to partners from the pharmaceuticals industry. And that referred to a more general topic to it, saying that if we are deciding on scientific questions, those answers or the decision should be completely free of the pharmaceuticals industry opinion, which of course is only a subgroup of the total pharmaceuticals industry because only a couple of companies are attending. And in more particular, it was addressing the topic that certain aspects of clinical decision or clinical questions are kind of excluded, like head-to-head comparison, etc. And the third element that was addressed here is that foreseeing the possibility to sell real-world evidence and innovation and information generated on the platform to governmental bodies, for governmental authorities, for health technology assessment. The prerequisite for those governmental bodies might be that the data was generated completely unbiased from the pharmaceuticals industry. That were, let's say, directions of where the answers came from.
Okay, Valeria Santini, Professor Santini from Florence University, made a comment, and this is, I think, is also a very important comment. Interesting to her talking about business models to further support Harmony, but please do remember that universities have ethical and conflict of interest limitation in this sense. How we will manage?
Yes, a very relevant question. You may have noticed that a couple of minutes ago I said one question, for instance, will be, do we provide access to the data, work with the data, or do we provide information? And in a European context, we are providing information generated by the data. So we will have to find means that are compliant with our European understanding of data protection laws, of scientific ethics, etc., to take a research question up, whether that is an ethical research question, to provide the answer out of the data. That could be by opening an anonymous data room, which will not allow the client of the data to misuse the data, but it could also mean that Harmony itself has a group of research data scientists that are providing the answer. And that is clearly understood, and that is something that is addressed currently in each and every IMI project, that any kind of commercialization, of course, has to be compliant with European science and data protection environmental aspects.
Okay, thank you, Dr. Miller. Professor Andrea Manca from York University required something about the real-world evidence data. is to provide real-world evidence data to government or HTA bodies. We have to demonstrate their values for HTA-like decision-making, how we can manage this.
This is a question that I have to give back because this is a question to the clinicians. A question that would be addressed in workshop number 1. What is the real world evidence that we can draw from the existing data that we have? What benefit would it have? In which aspects could we give benefit to current questions of health technology assessment that we are aware of? So this is a question that the clinicians will be in a position to answer much better in a guided manner, but much better than I would be.
Okay.
Maybe to be more concrete, it is maybe just to add, Jesus, it is obvious that real world evidence as it is existing on the platform, because the platform is one of the very limited that exist in the world, that comprising all kind of different data for one patient and for groups of patients. Nowhere else you find the information on pharmaceutical treatments, information on outcome, information on diagnostics and patient characteristics. Each subset of data today is lying somewhere, and there are commercial models for each of the subsets of questions, but very few people are in a position to combine all that information and to generate evidence out of it. And it is obvious that you can get better evidence if you have all that information at hand, as if you only look, for instance, into IMS data, where you have limited evidence, or if you look into old meta-analysis of trials under very different conditions, instead of looking into a subset of clearly defined fresh data. That is the idea behind it.
Okay. So I also have, we also receive a message in the chat. You can also read. I will read for those who don't have access to the chat because they are connected by phone. It's a message from Kathleen Hewitt. Kathleen, together with Bill Wood, are attending this workshop today. Join us. They are members responsible from the ASH Data Hub. And Kathleen told us early this year, ASH Research Collaborative completed his business model project, and the business plan was launched this summer. We are happy to participate on the workshop if helpful, designing a business to address the needs of various stakeholders, commercial and non-commercial. It's not easy, of course, but can be done. Congratulations on your progress so far. Thank you so much, Kathleen. I think you are welcome. We were in touch, and I will use also this forum to tell you that maybe we can have a TC next week, or in the next 10 days, we can organize this TC that was to continue with these links between Harmony and ASH Data Hub regarding not only myeloma, but also these other topics that we are managing now. Thank you, Kathleen. Thank you, Bill, also for attending the meeting today. I don't know if there is any other questions. We are just on time. Maybe we can have a last question if someone want to raise the hand or make a kind of...
Did you address the question of Valeria Santini, Jesus?
Yes, it was already addressed. Yes, it was.
No, maybe one comment on my side, Jesus.
Okay, John Butler from Bayer.
Yes, I just want to encourage everyone, in particularly our academic physicians, our so-called KOLs, to make an effort and participate in the workshops planned for next week. I think, sorry, next week, no, the week after next. I think this might all sound a bit confusing, but at the end of the day, the most important thing that needs to be determined is, where do you want to take this consortium? Where do you want to take this endeavor? Do you want to end it? Apparently not. There was an overwhelming majority advocating for continuation. The question is how. And if it's going to fulfill the original vision one day of registering, if not everyone, but at least a very substantial fraction of all European patients in hematological malignancies, to collect that data, longitudinal data, in one big research resource. Then the second question is how can we make that work, and how can we generate the necessary funds? And I'm very optimistic that there will be no unsurmountable ethical questions here, because let's not kid ourselves. We're not going to become rich here, personally rich. We're talking about allowing this resource, this research resource, to survive the end of the AMI program and to thrive in the future. So it will be extremely important for the KOLs to participate and give their opinion and their willingness to commit in the very first phase of these workshop in 2 weeks. Oh, thank you very much.
Thank you, John. I fully agree with you, and I fully agree with this point coming from one of the FPM members from the steering committee. So I will fully support this, let's say, this open question. This is a challenge for all of us, for all the clinicians, for all the key opinion leaders, to really provide their ideas about how they foresee the future of Harmony, and which is all the potentiality that we will have in the consortium. And I think it is today is the day in which we have to encourage this participation. We will invite from the Harmony office. I am quite sure that not everybody or everyone is opening all the mails that they are receiving from the Harmony office. And I will take care, and I will send a personal mail to all of key opinion leaders in order to get as much involvement as possible in these meetings, in these workshops that will provide the best ideas about the future in Harmony. So thank you so much for actively. I don't know if Dr. Müller want to add some further last comment.
Yeah, maybe just two concluding remarks here. First, addressing to what John Butler just said. I think that is a very important message, because I believe, and I believe that you believe, that what you do in Harmony is the only right thing to do in order to make research better and to make treatment of patients better. You all know that single clinical trials and single center aspects, especially in diseases which only have few patients in one center, that is the only correct thing to do. Pooling data, getting the information across a huge number of patients, getting all kind of information in a comparable, what means standardized, in a comparable manner. Data from trial 1 comparable with data from trial 2, from center 1 to center 2. It is, you all are convinced that this is the only right thing to do. So if you're all convinced, think of what John said. There are only two possibilities after the grant period. Possibility number 1, Harmony is over. And I surely believe, and the survey has shown, none of you wants that. All of you want that Harmony is sustainable and continues to exist because it is good. So the second option is, if option 1 is not a valid option, the second option is to conclude and to find a structure and a set of services and a mode to generate revenues for Harmony to exist after the grant period. And we all know that this is not easy. We all know that also with the project, we have been tackling very sensitive questions, very different perspectives and interests of the people contributing to this fantastic work. But let me remind you, we are now towards the end of the project. The 2 workshops are extremely important, and we would be grateful for each and every strong opinion participating in the workshop and making those 2 workshops on the 28th and the 29th a success. That was comment number one, and comment number two is only to express my thanks for all of you contributing so far with feedback, with interviews, with open opinion, with a lot of criticism on certain remarks, etc. That is great, and this is exactly what we need in a consortium like that. Thank you very much. We look forward to supporting you towards the end.
Thank you, Michael, and thank you so much. And of course, Harmony is not an easy task from the very beginning. So, and we have to continue to be and to survive in this non-easy task. But this is something that we manage usually. Most of us are clinicians taking difficult decisions all the day by day, with difficult patients in order to improve their quality and quantity of life. So it is something in which, okay, it is our routine in the day-by-day scheme.